Hello, my name is Debbie Reynolds. They call me the Data Diva. Today I want to talk about the coronavirus known as COVID-19, pandemics, and data privacy. This is an unprecedented time in all of our lives where we are all dealing with a global health crisis due to the pandemic of COVID-19. All over the world, people are reacting to the things that are happening related to this particular virus, how it's spreading, and the things that they need to do for the public health. A lot of people ask me about COVID-19 particularly, but I can also talk about pandemics and data privacy and how they're related. Whenever there is a health situation that has to do with public health or a threat to public health, there are certain rules and regulations that kick into place that would not normally be in place. So on an individual level around the world, regardless of where you go, health information is typically some of the most protected and sensitive information about an individual that you could possibly imagine. So many countries have lots of laws about the sensitivity of health information, who can have it, and what should be done with it. In a pandemic situation like COVID-19, a certain set of rules kick in that are not typically in place because of the threat to public health. So for example, if someone were to share information with a doctor, this would be considered private information and they would not have to share it unless there was a real reason to do so. In a pandemic situation or any infectious disease situation where it's a threat to public health officials on the local and possibly the state level, and because of the COVID-19 pandemic, also at an international level, many different people will need to know information about an individual if they should have this virus. So in those situations, a doctor will be required to report to their health officials about someone having a particular infectious disease. The health officials would have to do an investigation of sorts to find out who the person was, where they possibly could have gone, who they could have exposed, so that they put mechanisms in place to contact those people and be able to set the right precautions in place. When you're thinking about health information in general, you need to think about it in terms of have to know, need to know, or want to know. So a doctor who's working with you and trying to diagnose your issue would have to know or need to know information about you. Another example of going to a pharmacist, they may not need to know what your issue is, but they may need to know your name to give you a prescription. And then want to know is just people's natural curiosity and sometimes fear about a viral situation or a situation about public health. As you know, most of the times when people are talking about COVID-19 or other types of infectious diseases that are impacting people, they're talking about people in terms of numbers and statistics, or they're talking about them in terms of anonymous information. Of course, this does not preclude an individual to tell be able to share that information with other people if they should choose to do so. We recently saw this with actor Tom Hanks, where he divulged that he had COVID-19 and he was in isolation in Australia. So the thing to keep in mind is the have to know, need to know, want to know feature of any type of pandemic. All these agencies that are working together, they only divulge the minimum amount of information that is needed to be able to do their jobs and do the work that they're tasked to do. So this isn't like a party line where they're telling people's names and everything, but it's a situation where every level has rules and procedures that they have to follow to protect the person's privacy as much as possible. That's it. Thank you. Be well. Thank you.